Through the years, you have probably known a number of people who've had cataract surgery. It's one of the most common medical procedures performed in the United States. More than half of the population over 60 years of age has some degree of cataract formation. Most cataracts are not caused by disease or illness, but are formed as an ordinary part of the aging process. As we get older, the normally clear lens within the eye becomes clouded. During cataract surgery, this clouded lens is replaced with a clear implant lens. In the past, restored clarity and distance vision was about all this procedure could offer. Now, with the innovations in lens crafting technology, other vision problems can be addressed at the same time. Reading glasses can be eliminated and low light vision can be improved. With these expanded vision benefits, many people choose to deal with cataracts in the earlier stages before distance vision is severely compromised by the clouding lens of the cataract. The following videos will help you understand cataracts and the new opportunities for vision improvement that are available to those who suffer with cataracts.
The most common procedure is a cataract surgery.
We reassure the patient that the surgery options that we have available for treatment of cataract nowadays are very good, very safe and effective. And the surgery itself is fairly quick and easy surgery to do nowadays.
Before my surgery, I needed glasses for just about everything I did. At work, at home, even going shopping, I always had to remember to bring my glasses. That's when I decided to see my doctor. During my exam, he discovered I had cataracts, which was why my vision was cloudy. My doctor explained that a cataract can be the reason sharp images become blurred, or seeing things at night is more difficult. As your eye ages, it loses the ability to see near objects. This is known as presbyopia. He explained that the treatment for a cataract is to remove it and replace the clouded lens with an artificial lens. He told me about the AcrySof Restore lens, which delivers a high level of freedom from reading glasses or bifocals for cataract patients. The unique apodized design of the AcrySof Restore lens is designed to reduce the effects of glare and halos. The doctor will make a tiny incision in your eye and perform a procedure that uses a small instrument about the size of a pen tip to gently separate the cataract into smaller pieces and remove them from the eye. Once the cataract is removed, the AcrySof Restore IOL will be inserted into the eye. Once in your eye, the lens gently unfolds and is set into its permanent position.
Hi, I'm Jill, and I'm glad you're taking the time to learn more about your vision. During the next several minutes, we will be discussing how the eye works, how it changes over time, as well as some of the options your doctor may use to help you see more clearly again. Whether we are seeing the smiling face of a loved one or a favorite television show, our eyes are a window to the world around us. Near or far, the young eye can focus on just about any object. But what happens inside the eye to make this possible? As early as the 1930s, it has been theorized that the eye's natural lens flexes and arches. The purpose of this portion of the video is to illustrate the accommodative flexing and arching which take place in both the natural crystalline lens as well as the crystal lens accommodative intraocular lens. As the focus changes from distant to near objects, the ciliary muscles contract, the ciliary fibers slacken, and the natural crystalline lens becomes more rounded to provide near vision. This process is known as accommodation. As we get older, however, our natural lens begins to enlarge and harden, resulting in the gradual loss of accommodation. This is followed by the eventual formation of a cataract, where your natural lens becomes cloudy, preventing a clear image from forming on the retina. Today, cataract surgery is one of the safest and most common surgeries, with nearly 3 million procedures performed in the United States each year. After the doctor removes your cataract, it is replaced with an artificial lens called an IOL. It is important for you to understand that you now have a choice to make regarding the type of lens you'll receive. Standard monofocal IOLs have been widely used for the last 3 decades and generally provide excellent distance vision. But because they do not move or change shape inside the eye, patients receiving these standard IOLs will likely require some type of spectacle correction for their near and intermediate visual needs. You may choose to replace your lens with the crystal lens accommodating IOL. Like the natural lens of a younger person, the crystal lens provides a full range of focus from distant to near objects by moving back and forth along the visual axis, as well as arching or flexing centrally to increase the eye's focusing power. Approved by the FDA in November of 2003, the crystal lens is an exciting technology that your doctor can use to help bridge the generation gap and allow you to enjoy the kind of intermediate and near vision you experienced in your middle adulthood.
A cataract is the clouding of your eye's lens that occurs naturally as we age. It may be why sharp objects appear blurry, colors look dull, and why you may have trouble seeing at night. The only way to correct cataracts is with surgery. The good news is that cataract surgery is one of the safest and most effective procedures performed today. Your doctor will make a tiny incision in your eye using an instrument about the size of a pen tip to gently separate and remove the cataract. Once it's removed, a new lens is inserted that unfolds into its permanent position. Your vision after surgery will depend on the cataract lens you and your doctor choose. With the introduction of the AcrySof Restore lens, your options have never been better. Unlike traditional lenses, the breakthrough AcrySof Restore lens lets you see near, far, and everywhere in between. The big picture and the details. Your eye doctor may recommend another advanced lens called AcrySof Toric. The AcrySof Toric lens works with the abnormal curvature of your eye to correct the blur caused by astigmatism and the fog caused by cataracts. The only time most patients need glasses is for reading. Your eye doctor will help you decide which lens is right for you.
Now that you know a little more about cataracts and their treatment, we hope that you'll be better prepared to make decisions about your present and future eye care.